Hi, Dr. Hussein. Thank you so much for all your help over the last few weeks. Mum is a lot better. But you did mention something called heart failure, and that got me a little bit worried. I'm not sure what that is, and I just want to know what heart failure is and how you diagnosed it and what the symptoms are so I can raise more awareness because she is so much better. And I'm just so grateful. Oh, you don't have to say thank you. It's our job to help your mum, and it's been an absolute pleasure. I'm really pleased that she's feeling better, and hopefully we'll be able to monitor her and further improve her quality of life. Now, with heart failure, it doesn't mean that your mum's heart has stopped working. It's just that it's not pumping as well as it should, and there are various different reasons for it. But before I say that, your mum came in, as you know, with ankle swelling, shortness of breath, and she was very, very tired. These are some of the cardinal signs of heart failure. And so if someone comes in with this kind of combination of symptoms, we do a various kind of range of investigations. So we did your mum's blood test, we did her ECG, we did a chest x-ray. We also added on to the blood test something called BNP. Now, this is a protein that's released by the heart muscle when the heart is under strain and could indicate heart failure. So when that came back and it was positive, we then sent her for the echo, which is the jelly scan of the heart, and that gave us an idea as to what was going on with her heart. And it did show that there was some sort of decline in function or pumping function of the heart. There are various different reasons why someone might have heart failure, and these are, for example, heart attacks. So if somebody's had a heart attack, it means that they may have had damage to the muscles of the heart. And if the muscle of the heart is damaged, then that can lead to heart failure. Also, cardiomyopathy, this is where there's enlargement of the heart muscle, and heart muscle being enlarged is not good for it. It doesn't pump as well. Also, high blood pressure, and I know your mum has had high blood pressure, so this could be the reason why she developed heart failure, because high blood pressure can put a lot of strain on the heart because your heart is pumping more to maintain a certain pressure. And that leads to enlargement of the ventricles, which basically means that it doesn't function as well. There are other causes as well of heart failure. So, for example, if someone's got an arrhythmia, so atrial fibrillation, so their pulse is irregular, so the heart is pumping irregularly, that can cause heart failure. If they've got anemia, if they've got a heart valve issue, if there are abnormal proteins in the heart muscle, for example, amyloidosis, but your mum doesn't have that. Sometimes lung issues can lead to heart failure as well. Also, if someone's been on treatment for cancer, like chemotherapy, also thyroid issues, alcohol. So quite a lot of causes of heart failure. And we do classify heart failure into 4 stages. So the first stage is where you have no symptoms at all. The second stage is where you don't have any symptoms when you're resting, but only when you're doing something. And you could be doing, brisk walking, for example, and you develop shortness of breath. Stage 3 is where you don't have any symptoms at rest, but minimal exertion causes the symptoms to come on. And then stage 4 is where you have symptoms no matter what you're doing. And the treatment for heart failure is all about trying to minimize the strain on the heart. So we use medications to help the blood pressure stay low, help your pulse rate stay low. So that's why your mum's on a combination of medications to help her heart and help her quality of life. And it's so important that your mum continues to follow a healthy diet, exercise when she can. It's also important to watch the amount of fluid you drink every day. I know your mum doesn't smoke, but I always say to patients that smoke to stop smoking and to limit their alcohol. But yeah, I hope you found that information useful. If you need any more information, just come back and see me. Wow, thank you so much, Dr. Hussein, for all that information. It's so useful. I will be raising more awareness about heart failure. I think it's so important. The fact that my mum was diagnosed in time really changed her quality of life. She is more stable on the medication. I will raise more awareness about heart failure, so thank you for that.